Live every moment now. You will notice on the YouTube.
So do I have, so it's in Zoom and it's in, oh, here we go.
Yeah, there we are. Okay. Okay. So welcome to the TRT and hormone optimization, everyone. I have as a guest, I'll put my sound down, as a guest, Brian Burk. Welcome, Brian.
Steven, welcome. Thanks for having me again.
It's an
Welcome.
honor.
Welcome to beautiful Miami. You can see a little bit in the background.
Yeah, nice. Is it, what's the temperature out there?
It's beautiful and 80 something degrees outside today. So it's not too bad. It's about 83, 84, nice breeze, not too sunny. As you know, as a dermatologist, we have to watch how much exposure to the sun, right? So
yeah, right.
It's
Get
nice.
your screen on.
Always, always.
Okay, so let's start out with some questions that I already got up front via Messenger and Facebook and in the YouTube comments. So one question was, are there any side effects of TRT that we can just expect when we start out?
I wouldn't say that there are any side effects that are going to happen. Absolutely. I would say that there are side effects that you can watch out for. You know, our hope is obviously that people do not have any type of negative side effects. And, you know, so that's one of the reasons that we work closely with all of our clients to try to ensure that they don't have any negative side effects. We run follow-up labs. You know, I'm sure most clinics run follow-up labs, usually probably 7 to 8 weeks out. Some of the side effects can obviously be acne, as you know. There could be some aggression. That's very well. We've never had that happen, by the way. We work with a lot of guys, and we always are telling people that, hey, if you feel a little bit more agitated than normal or any type of aggression, you know, just please let us know. And no one has reported back with any of those symptoms. You know, I would say probably the biggest one might be site injection issues. You know, every once in a while someone will inject. We do a lot of injecting. We some guys have cream or used cream, as you know. So you know, sometimes you'll have a little irritation at the site, but we're always hoping for no side effects, and I think for the most part we avoid them. We also tell hair thinning is a possibility. You know, obviously when you're taking testosterone, you're impacting some downstream hormones as well. And so we're trying to keep those as balanced as we can. And then we're always watching out for any type of, you know, negative side effects related to those. But if we can balance someone, you know, it's great. And then over time, you know, as you've discussed on the channel before, you're trying to sort of dial in to each individual's unique levels and when they feel their best, and you're always making ongoing adjustments to make sure that people feel at their best. I will tell you, we had one guy, so this is a case which is interesting, where a level or a dose can be too high. You know, a lot of guys come to us and they're sometimes less is more. So I have a client who's about the exact same physical size as me. He's about 6'1", 200 pounds, and we were taking about the same dose initially. And when we ran his lab work, it looked good. You know, he's on the high side of normal, but everything else was really balanced. But he felt that his libido was off a little bit. And so in his case, we downward adjusted over time, and we dialed him in, and his dose ended up being about half of what mine is. And so and he was a rare case, by the way, because most guys, I think, have a much better libido over time. But his was the rare case where his levels were a little bit too high. You know, could have been estrogen was well, I don't think it was estrogen, actually. That was fine. But, you know, maybe it was the testosterone, maybe it was the DHT, and he didn't feel like he was at his best. So we're downward adjusted. And that's the case where we're trying to tell people, don't pay attention to numbers necessarily. Yes, it's a good guideline, but more sometimes is less. And so that was a rare case. But for the most part, there are none that we go into it thinking we're not going to have any type of symptoms, and we're hoping that we don't have any. And then if we do run into the rare one, we obviously try to address it.
A question that I actually got today was about blood pressure. Is there any relationship between testosterone replacement therapy and maybe higher blood pressure?
It's listed. It's always listed as a potential side effect. What we have found is that in most cases, we get people healthier, and over time, their blood pressure levels are better. So we've actually taken some. This is more in the case where people come to us and are not in great physical health. Maybe they're obese. Maybe they're on blood pressure medication. And we always set out a goal, which is if you lose weight over time, obviously they're working with a primary care physician on the blood pressure medication. So we tell them that our goal is to potentially get them off of it if it's possible. But of course, they would be working with their primary care physician on that aspect of it. And then over time, as people lose weight, as they become healthier, as they're getting rid of body fat, as they're adding lean muscle, they tend to end up having better blood pressure. But it's always something that we are looking at and monitoring. There have been some cases where guys felt that they were high, so we end up just telling them to buy a cuff and to track it, and then to send us the results. And usually it's probably in the cases where we had someone who was high, it wasn't really related to their actual testosterone therapy. It was more related to lifestyle things going on with them. So we always ask them, hey, has something changed in your life? Are you under pressure? Are you under stress? Are you sleeping less? How's the diet? And we take a look at all those aspects. But it's listed as a side effect, and it's something that we're always taking a look at. But thankfully, we haven't run into it very often.
Mm-hmm. A question that always keeps coming back. That's also I had one in before. Is there a certain list of supplements that you recommend with TRT?
A lot of times we'll take a look at, DHEA levels. We take a look at vitamin D levels. We take a look at thyroid levels. We take a look at some cardiovascular markers. We take a look at hemoglobin A1C, B12. And so we run a really sort of thorough panel. And when we see that people are really deficient in certain areas, then we'll tell them that they would probably benefit from supplementing. And then over time, vitamin D, by the way, is a really big one, very critical. There's a lot of data out there that suggests that your risk of having certain types of cancer is drastically reduced when you have better levels of vitamin D. Obviously, at the moment with COVID, there's an unusually high number of patients that have passed away with really low levels of vitamin D. So during the whole COVID pandemic, that's one of the things that we were obviously stressing, very important to all of our clients, is to make sure that they're supplementing with vitamin D. There are a couple other supplements as well, like zinc, vitamin C, can help the immune system. But so vitamin D is one which is always important. It also has an impact on other hormone levels. It can help with SHBG, can help with free testosterone. And like I said, we look at DHEA. We look at the thyroid levels, so a lot of times, people will be on the low side from a thyroid hormone perspective. This is not TRT related, obviously, but we do find that people are on the low side of thyroid hormones. But one of the first things we suggest is obviously change your diet. I think in a lot of cases, if people ate healthier and they ate better foods, they would be giving their body the fuel which is necessary for their own body to regulate levels. In replace of that, that's, by the way, if we can get a hold of, good food, right? I think that some of our food is becoming less and less nutrient rich. Sometimes we'll say take a thyroid supplement, or like I said, we'll suggest some dietary changes where they can boost it, or take a supplement in the short term and see where your levels go. Obviously, cholesterol, by the way, there are some people that could be negatively impacted if they're not eating enough cholesterol. There are certain cases where people can have low levels of testosterone because they don't have enough cholesterol. So I think those are the major ones that we take a look at. You know, DHA, vitamin D, you know, B12, if it's super low, if it's really, really low, you know, the thyroid hormones, but, you know, it's not a huge list.
Okay, Brian.
Boron, by the way, I would say we recommend a lot boron. I think that you've had a doctor who's a big fan.
Yeah, Jeffrey Rutherbush talked about boron, yeah.
So I did a lot of research on boron, and there's a lot of great data that suggests it's something that you can take, you know, low dose. It has a lot of positive health benefits. And so boron's another one that we recommend in certain cases to some of our clients. And, you know, it's a great supplement.
Mm-hmm. Two more things that I wanted your thoughts on. First, metformin. Do you use it in certain patients?
Well, there's, I think, two uses for metformin in general now, right? So you have the type 2 diabetics that use it, and then you have it from an anti-aging perspective. It's very popular in the anti-aging community. We do use it with some guys. We've used it in certain, obviously, by the way, the best way to address, you know, higher levels of blood sugar is dietary change, right? Like, sure. That's the number one important thing to do. In the short term, sometimes we'll take a look at metformin, and if the doctor thinks that it's you know, good for a particular client, then we'll recommend metformin and see how they respond to that. You can also there's some data that says that it can support with help weight loss. It's interesting. There are some guys though with metformin, so it has some anti-muscle building aspects to it. So some guys, you know, we don't recommend this with our clients so much, but there are guys that are heavy lifters that want to build muscle. You know, I read in the forums and a lot of research and YouTube channels. So some guys will suggest that you could take metformin on your off lifting days and to not take it on your lifting days. So there are some guys, but those are the guys that are doing it more from the anti-aging perspective. So we do use it on a case-by-case basis, but it's not a huge one that we use. Okay. You know, sometimes I would say for the most part, it's more in the short term when we're trying to get someone healthy, and then we just see how they respond to it, and our hope is obviously over time, if we're doing it to control blood sugar, you know, that it's not needed.
One last thing that I wanted to talk about before I will scroll down the questions in the chat box there. Tadalafil, do you recommend it to your patients for maybe libido aspects or blood pressure control? What about it?
Yeah, in fact, we're big fans of tadalafil for certain cases. Obviously, it has the positive from a ED perspective, can help with libido. You know, we always talk to our clients, you know, about we have very frank conversations about sexual health. And so it's an area that I think a lot of guys struggle with over time. And so I always think, would a guy have a stronger libido and have more of an urge to have sex if he knew that he can have an erection? And, you know, I think that plays an important role in many men. And so I think that it's a great tool in the case where guys have, you know, some erection issues, you know, and it's a really positive health benefit. There are other guys that can take it because it's really good for cardiovascular health. There's a lot of data that supports that it can help reduce CRPHS, so cardiovascular inflammation marker. And then it is bigger in the workout community. So some guys can take it as a sort of a pre-workout. I tend to take it just for general health. For, you know, I think it has a lot of positive health benefits for myself. Very low dose, and you know, so it's like a trifecta for cardiovascular health. It helps with the workouts, and then obviously it helps with sexual health as well. So so we think it's a really great product for people who need it.
And what's the normal dose then? Is that 5 milligrams daily?
You know, I think it can range from 5 to 10, sort of depending on how someone responds to it. I think 5 is usually the going in dose. And then, to the extent that someone doesn't respond well or doesn't feel like it's making much of an impact, I think that we have some guys that take 10 a day. So, and I think it's a great, from the sexual health perspective, I think it's a nice product or, medication because it's a very subtle medication. It works, but you don't really realize that it's working. If that makes sense.
Yeah. Great. Let's scroll down the chat box. Hi, Dan Vasalo. John Doe, there's a question there. I'm a combat vet. Since leaving the service, I felt out of sorts. Is there a correlation between trauma, TBI, concussions, and testosterone efficiency?
That one we don't have a whole lot of experience in, to be honest with you. I would say that there are, that's something I probably can't comment on. I would say related to sort of, maybe mental health or trauma. I do believe that there are some people who may benefit from, mental health perspective being on testosterone, guys that are suffering from, some form of depression. I know in my case, one of the original reasons why I went to a clinic and started taking testosterone is that I just didn't feel like I was myself. And I had very low motivation, hard time getting in shape, and was suffering from, I would call it a mild grade type of depression. And it dramatically helped me sort of dig myself out of that hole.
Okay, so someone asks about Starsky 182. Red blood cell distribution wide and monocyte count. It increases on TRT, he says. What does it mean?
The monocyte part, I'm not going to be an expert on certain details of this. We track obviously red blood cell count, hemoglobin, and hematocrit of all of our clients over time to see if they're trending upward and if they're getting into too high, from a level perspective. So it's something that we're always monitoring. We don't run into too often where guys, increase to the extent that they have to donate blood. But there are some guys who are super responders, even at lower doses of testosterone. I mean, usually we're trying to manage that with, guys not taking as much testosterone or reducing the dose and seeing if that has a positive impact on it. But we do run into certain cases where guys are producing a lot more, red blood cells. And so, at that point they have to donate. But the actual technicalities, that's why I work with a couple of really great doctors. And so they deal with the really, really complex issues. I know more about it from the high level perspective and sort of what we're looking for. And then, the doctor's work on both of those items.
So, Jeroen Keming, hi, back to the Netherlands. Scrolling through the questions. Do you have any experience with prescribing low dose nandrolone, Brian?
We've used it in a couple cases, and this is more for sort of joint issues.
Yeah.
Very low dose though. A lot of guys, by the way, come to us that I think want to take, they want to take DECA for the wrong reasons. They may want to increase size. And so we have, like I said, used it. It's usually when, someone has had an injury and they've we document the injury. But I think we've only used it a couple times, very, very small number. So we don't have a huge number of experience. Now, those guys both have responded really well. I mean, they're just, by the way, these guys are average. Most of our clients are just average middle-aged guys who most of them, are not heavy weightlifters. They just want to, be in pretty decent shape. We don't have a lot of bodybuilders. We do have a couple of, IFBB pros, so fitness guys, but they're not huge guys. So none of our guys are really trying to pack on a tremendous amount of size. And so we don't get a lot of requests, but every once in a while we'll get a phone call for people that are looking, specifically to take nandrolone. And then we just try to explain to them, we know right away when they call and they're asking about dosing, what their primary use is. So, I'm not sure 90 milligrams a week to 100 to, I do know that the guys, because I'm in the, I've read through a lot of the steroid forums. There is a percentage ratio of guys who are stacking that they need to take of nandrolone to testosterone to maximize benefits. But again, that's just me sort of researching and being interested in it. But I don't personally have any experience taking it. And like I said, the couple guys that we have taken it, and it's alleviated their pain issues, which has been great for them.
See, Dave, he is worried about his prostate size and PSA. His urologist says there's no cancer, just a big prostate. How can I reduce the growth rate while on TRT? What's your take on that?
Well, his urologist probably has a little bit more experience than I do in that case. I know, well, there are two things that I know you can take tadalafil that can help, at least with the urination aspect. I believe that there are certain guys that are prescribed finasteride, and it's a really high dose. So we're not huge fans of that. This is not something that, this is another thing that we always take a look at as a side effect, right? Because it's listed as a side effect that your PSA can go up, that your prostate can increase in size. And so we're always telling guys to pay attention to how frequently they're urinating at night. Can be a sign that they have a larger prostate, or relative to the testosterone. But again, we haven't had any guys that have come across that have had the issue that he's talking about. I do, like I said, daily tadalafil, I've read, helps. That's something he could talk to his urologist about. He could talk to him about finasteride, but again, I think there are a lot of downsides of taking the finasteride. So in his case, it may be, picking the lesser of two evils.
Yeah.
Right. Like sometimes in life where you have to choose the best course. It may not be a perfect course of action, but you're trying to choose the best course of action. Mm-hmm. And, so he could also, if being off of TRT, if he felt better off of TRT because it relieves some of the prostate issues, then he, might have to consider coming off the TRT. So again, it's sort of weighing. It's right. We always have these decisions we're making in life, which is which one is the best course of action for us. Mm-hmm. Hopefully, you can find a balance. But like I said, we're fortunate. We have a lot of we have a lot of guys that come to us, and most of them are pretty healthy for the most part. Within, by the way, I consider now in America, we get a lot of clients that are obese, right? In a very crazy way. I don't necessarily think obesity is healthy. Long term, a lot of people are going to run into health issues, but they're not coming to us because they have really specific bad health issues. They're coming to us because maybe have energy issues, or maybe they're having a hard time losing weight and they're trying to dig themselves out of this hole. So for the most part, we're working with healthy patients, and we're trying to make them more healthy and actually get them out of those sort of chronic illness risk categories. And we're pretty successful. I mean, we'll get guys that come to us at 28, 30, 32% body fat, and they still look relatively okay because you can wear baggy, you can hide weight pretty easy as a man, right? Just don't tuck your shirt in, wear bigger shirts. Clothes sizes are getting bigger and bigger in the States, and so you can sort of hide, camouflage some things. But they also could go the opposite way. So we're trying to catch them and get them moving in a positive way and get them out of the obese category before they keep gaining more and more weight over time, and they sort of dig themselves into this hole where I think the heavier you get, the less the worse your hormone levels are in general. If you keep gaining weight, there's a chance that your testosterone level is going to continue declining, which is going to make it easier to gain weight, which is going to make your testosterone lower in many cases. And so you can dig yourself into a big hole.
Yeah. One friendly young man that I'm coaching with his fitness and diet, Jeroen Kemink from the Netherlands, has an interesting question for you, Brian.
Okay.
He says, what's your opinion? In the Netherlands, we can only get for TRT Androgel or Sustanon 250, and that is injected every 2 to 3 weeks. Which one is the best of those two very bad choices?
Oh, that one's a hard one.
Yeah.
You know what I would suggest? I don't know which one is better. What I would suggest is potentially experimenting with both. Maybe he does a 3-month, he could work with his doctor. Now, again, he's injecting 2 or 3 times. What is it? Once every 2 or 3 weeks, which obviously we're not huge fans of. We're a fan of multiple times a week, lower dose, clearly. But what I would suggest, if, sometimes, again, take the best of 2 bad options, right? So it might mean experimenting with both of those over the course of the year. Sometimes what we explain to our clients is that, we're obviously, when people come to us, they want immediate results. We want people to have immediate results, right? Who doesn't want to lose 20 pounds in a month? Who doesn't want to, feel dramatically better in a month? But we also try to explain to everyone that first, your hormone levels didn't become deficient over time or suboptimal, from one day to the next. This is usually a slow, gradual decline. I think they estimate that testosterone levels decline, 10 to 20% a decade. In some cases, I think it could be greater than that, right? At the same time, you're not going to get in shape, or feel better in a short period of time. So why not, maybe take the first year? If you look at the overall arc of your life, and I'm not sure how old he is, but let's
25, 27, something like that. Okay, not 30 yet.
So he's 27 years old. Let's say he's going to live for another average lifespan is let's say 80, right? So 73 years. Why not take a year and try to figure out which program is the best? Why not take 6 months and try one and try 6 months of the other? And maybe you can sort of go back and figure out, which one did you feel best on, which mentally, physically, and then you could make a decision. You have sort of 2 not great options, but you can then from a personal perspective, make a decision. And I think that, another thing which is important to understand is that different people respond differently to different protocols. So, he may go to a forum and find a thread and do some research. And in that forum, they may be pro one versus the other. He may find a different thread, and that thread may indicate that there's a different, another one, which is the other option is the better option. And so you'll get conflicting data. I don't know. I would probably myself try the injections first, but but again, I don't think there's anything wrong with like I said, taking a year and trying to figure out what's best. I mean, we do that a lot with our clients. Even, we may start them at an initial dose, say an initial program, and say, listen, let's take the year and chop it up into 3 to 4 month segments. Yeah. Let's see what type of progress we can have in the first 3 months. You come in, we also have a body composition scale. So a lot of our clients that come to us are trying to get in a little bit better shape. We have some guys who come to us and they're in excellent shape, like yourself prior to starting. So you're coming, clients like you are coming for a totally different reason. But we do have a fair number of clients that are coming to us and they're trying to recompose their body, get in shape, and feel better. So we're working with them constantly over time, and we bring them into the office and we have them weigh in on the body comp scale, and we sit down and we talk through, hey, how are you feeling? How's the diet been over, first of all, how do you feel? Do you feel stronger? Have you been able to go to the gym? How's the diet been? And we have data points, which we have the initial body composition scale weigh in. And then when each time they come into the office, we can sort of see if they're making progress or not making progress. And we may need to make some tweaks based on progress. They may be making great progress from a physicality perspective, but still not feel great. And so, we make adjustments both on physical progress, but I think also how they're feeling and emotional progress as well. And so, and it's working with someone over time. And then the longer that you work with someone, the more adjustments that you make, the better off that they feel. And so, like I said, in that case, if you don't have great options, maybe experiment with both. Talk to your urologist and say, hey, is it possible? How long do you think is a good enough experimental period with each item that I would feel, and make sure that the urologist is okay with you switching.
Yeah. Best, of course, would be to try to educate the provider and ask him if it's possible to inject every week 1/3 of an ampule, for example.
Yeah. I wonder also sometimes, are they constricted by whatever the medical profession is in that country?
Yeah, probably.
Sometimes it's unfortunate, but I think that doctors, the way that they're classically trained, are doing something within a certain type of protocol.
I think even on the leaflet of Sustanon 250 here in Belgium and Holland, it even says this has to be injected every 3 weeks intramuscularly. Point,
right.
Period. So the doctor sticks to that, and he sees no options to go around it. So
right.
Yeah.
I wonder if they would do some type of study which asks the clients how they feel on day 2 versus how they feel on day 20.
Yeah.
Maybe that could start some change. Or maybe if they did some lab work, frequent lab work, and they found out what is the testosterone level, what are your levels on day 1 versus what are your levels on day 20, maybe that could start to change some minds over there. I don't know. We don't have any experience with Sustanon here. But yeah, it's unfortunate.
Yeah. What's your thoughts on putting a young man like that with low testosterone levels and symptoms on nolvadex instead of TRT?
Nolvadex is like an anastrozole, I think, right? So it's an estrogen blocker.
It's tamoxifen, I guess.
Yeah, tamoxifen. Yeah. So we normally wouldn't do that. We would probably try, something like Clomid first or HCG first. Try to, from a temporary perspective, see if we could try to get them. It's not something we probably would want to do long term. Try to see if we could sort of jumpstart the system to, get to a higher level. We've had some success with some very young guys who were obese, and their testosterone levels were just so low that there was no way that they were going to dig themselves out of the hole, the metabolic hole that they were in. When you have testosterone of 150 and you're 22 years old, I think it's very difficult for someone in that situation to be able to have the mental wherewithal to focus and get in shape on their own. How do you build muscle and have the energy to go to the gym, when you're at that level? And so we've been able to do some things temporarily with those guys. And if you can dig them out of that hole, we've had success at resetting some of these younger guys where they don't need us any. Our goal with someone like that is that they don't need us.
Mm-hmm.
We'll take them on temporarily, and we'll always tell them, look, our goal is to work with you for a certain period of time. And then I got pulled over once for speeding, and, really nice police officer. He didn't give me a ticket. And I remember saying to him, it was really great meeting you. I appreciate you. And I hope to never see you again. unless it's under a different circumstance.
Yeah.
You know, so I sort of try to say that to the younger guys that we work with, like, hey, we'd really like to get you healthy and get you to a point where you don't need us any longer. And it's worked for the couple guys that we've worked with, that we've taken on, that came to us in that situation.
Mm. A whole other thing. Where was that? Is there any way to prevent or minimize testicular shrinkage on doctor-prescribed TRT, 110 milligrams SIP per week? I already use HCG, but I still feel like they have shrunk. Brian.
Yeah, this is the, I know this is always a big concern. You know, I other than HCG, we don't really know of much that's going to help with that. I would say, you know, if someone is old enough and they're not going to have kids anymore, and if, you know, in certain cases, I think anecdotally HCG does help with libido. I do know that guys do take HCG for the aesthetic piece also, right? You know, at some point, you know, in America, HCG was not being produced. There's some pharmacies that are back to producing it, but we weren't able to use it for a while. And I know I told a lot of people, my friends, and, you know, some of our clients that I've become friendly with, that if I had to choose between my testes shrinking and disappearing or not taking testosterone anymore, it's not much of a decision to me.
Yeah.
You know, I mean, I feel great taking the testosterone. It's unfortunate. I think I probably lost a little bit of volume. I tend to not take it. You know, HCG is something that I tend to skip sometimes. You know, it's part of my program. I actually feel that it helps with my libido personally. I've taken, you know, I've been on it, and I've been on testosterone with and without it. So from a personal perspective, I notice a positive impact from outside of the testes from a libido perspective. So, you know, personally, I like taking it. And when I don't take it, I notice that my libido is off. So we don't know of anything other than the HCG. You know, I hate to say to cycle off of something. But, and this is, you know, I think is that Anthony would have to work with his physician on this. You know, if it's really a concern, you know, it might make sense to take a break, you know, every year or two to, you know, I don't know, do some type of post-cycle therapy and see if the volume comes back. You know, I'm saying, like, where we all have to, I'm not a big fan, obviously, of cycling. I don't consider it. And that's one of the things that we deal with. A lot of people come to us and say, hey, how long am I going to be taking testosterone for? And, you know, we're sort of a little confused, and you know, we have to explain to them, well, you're here for a reason. In general, it's because your body is not producing enough testosterone and you don't feel well. Do you think that that's magically going to change 6 months from now? Like, are you somehow, you know, yes, in the rare case where someone is young and they're in really poor physical health and we can get them in shape, yeah, we have had those type of success cases. But in general, as a 51-year-old guy, which I am, my body is not magically going to start making more testosterone than it was. And so a lot of times we'll refer to a book. It's I think it's called Testosterone for Life by a professor out of Harvard, Morgenthaler. That's a good one. I think once you start taking testosterone, you should consider that it's a lifelong project. Where I would say it's not a lifelong project is if you feel like you don't feel better when you're taking testosterone. I think that would be a very rare case, though. So again, I hate to suggest cycling on and off of something because I don't view it that way. But if it's if it's a huge issue, you know, it's something they might want to discuss with their doctor. Is, hey, do they think that would work if they did that every once in a while? But otherwise, we don't have any. There's no silver bullet that we know of that's going to change that.
Yeah. Does the chance at recovering fertility go down the longer you are on TRT?
I think that's probably individual to the person. we don't have any cases where any of our clients have been on TRT and not been able to get their wives pregnant. We're now 6 for 6. Some of the guys are older. In fact, the oldest guy decided to have a child around 53. You know, he didn't think that he was going to have any more children, but at 53, he decided that he wanted to, have another child, and he was able to conceive. So from our experience, we haven't run into any cases where it's negatively impacted. From a scientific perspective and from a logic perspective, I think that the longer you're on it, your body is not producing testosterone, or is producing less testosterone, and it's probably producing less and less over time, which means it's producing less sperm over time. And so I would assume that if you're on it for a longer period of time, it could impact fertility. I would say, and we tell this to most of our clients, that if they have a concern over fertility, they may want to freeze sperm, bank some sperm, just to be safe in the event that something happens. When we work with guys on the younger side of the scale, or guys that have one kid and they say that they may want to have children in the future, we always tell them that, why don't you think about it for 6 months, go on testosterone, see how you feel in 6 months to a year. If you feel amazing and this is something you're absolutely going to continue for the rest of your life, and you're really concerned about future fertility, that's a good time to maybe stop, take a break, bank some of your sperm, and then go back on TRT. And then of course, if you want to try naturally, try naturally. I mean, that's the fun part, right? I always say, like, try naturally for a long time, because then you and your wife are probably going to be having, more sex, which can, hopefully make life a little bit better. And then if that doesn't work, you can always look at the other options.
Mm-hmm. Great.
Although, by the way, relative to trying to have, I have a really good friend, and they were struggling for a while to have kids. They ultimately ended up having 3. This is a long time ago. But I remember him saying that it was the one time he felt like sex was work, because, his wife was very, hey, it's my temperature is up, get home. And so, and then I think after they had the first one, they had a couple, the next 2 were really easy. So it was pretty funny.
Yeah.
Most guys aren't complaining about their wives asking them to have a lot of sex.
Yeah, that's right. Okay, someone asked a bit a specific question. Is TRT safe if you have immunoglobulin A nephropathy?
That is one that I have absolutely no experience on. So
yeah, me neither.
I apologize for that. That's such a rare, a rare situation.
Yeah.
I mean, we're fortunate, we work with a lot of guys, but we don't have a lot of people that have come to us with really, with a lot of sort of pre-existing conditions and pre-existing things that we've had to deal with. So our clients are basically just your normal guy that you see walking down the street that doesn't, that just feels off. And like I said, it would be interesting if when we get every once in a while, we do get a case that we have to do a lot of investigating, and the doctor has to do a lot of investigating into, what's going on, which is always interesting. You always learn a lot in those situations doing the research.
Yeah.
But we haven't run into many cases like that.
I can imagine. Is it possible to feel the effects of TRT within a week? Better energy, clearer mind, and so, or is this just a placebo effect?
I just saw that question. That's a good one. Now, I think, because everything is your own personal bias, right? And I work with a lot of guys. For me, I don't even feel like when I started, there was one specific day or time that I knew that there was this change. I just think that with me, it happened so gradually over time. I mean, I went to the extreme. I lost 35 pounds in about five months, and I changed my diet. And there was no like magic day. I just remember looking back at the end of 5 months and I gained 30, I'd lost 35 pounds and I went from being obese to being pretty fit. And I thought to myself, man, that guy is dead. That out of shape, sort of depressed guy is dead. And he's never coming back to life if I have any type of control over it. I do have some guys who, including some good friends who were so low that they swear that they feel it. Like once they had the injection, they felt immediately better that night. So I do think, again, some people respond differently. I think that you could feel the effect. If you're really low, your levels are going to be higher. They're going to be dramatically higher if you're low enough. And but usually 6-7 weeks out, I think, is when you're starting to get towards where you're gonna, when you're doing the injections anyway, where you're gonna be long term. And so I think that that's a pretty good data point. But I think even guys take longer than that. But again, everything is different. We have some guys that I think again wake up like me 6 months later and they realize that they've changed and they have a lot more energy and they're out doing stuff. They're not taking a nap at night. And they don't realize it until they sort of reflect back. And then I do have some guys that, within a week or two, they'll text or email and say, thank you so much. I feel better. It's amazing. I'm going to the gym. Libido's increased for those guys as well. So all of their aspect, mental well-being, energy. Yeah. So we do have it. I think that's more rare, maybe 10%.
Okay.
But in general, it takes a little more time.
Mm-hmm. But what the heck, if it is placebo or real?
Oh yeah,
it's a good thing anyway. So
exactly. Well, I always say too, this is again to placebo effect. We have a lot of guys who really get into the workout, into the workouts. And there's some good data to support that, there are certain types of amino acid injections and vitamin injections, can help with workouts if they have the right blend. And, so I had someone, asking me, am I really going to feel the boost? Am I not going to feel the boost? And I always, I try to be honest with everyone. I take B12 injections, by the way, that are mixed with a bunch of amino acids. I take it more because I probably have low vitamin B12 levels to begin with. I don't notice anything. I'm always honest with all my clients. Yes. Do I take them? Of course I do. Do I feel any different? I don't. Me personally. Now I have other clients that claim that they're just dragging if they don't take, certain types of vitamin injectables. We're each of us are different. But I also tell them sometimes, hey, the more you inject, the more you inject, maybe the more you're motivated to go to the gym, the harder your workout is, again, the placebo effect, right?
Yeah.
The more you're doing, the more focused you are, the more locked are you in. You're locked in on your exercise, on your diet. I think it all starts to work hand in hand for the guys that really get into it. They start to see some results in the gym. Then maybe they're skipping dessert when they're eating dinner. That makes them lose a little bit more weight. So they see the progress in the mirror. They start to lose weight. Maybe the libido's getting a little bit stronger, and it sort of all goes, hand in hand as people start on a positive upward spiral.
Yeah.
And, so I think that, sometimes maybe the placebo effect in certain cases really does help with some people.
Great. We're almost at the end of this 1 hour Q&A. So a few more, Brian. Alden Stewart asks about initial bloating when starting TRT. Is it normal, especially in the face? And in the second part of his question, he says he's on week 5 of TRT and really struggling with bloating. I normally weigh 75, but sitting at 82 kilograms now. My blood work is 100%. Calories and sodium is in check.
Okay. So what I would say in this case, we have never run into bloating with any of our clients. So I would, especially not in the face, I would say there are some guys that may retain a little bit of water, more water when they're on testosterone. We're fortunate because, again, we have the body composition scale. So anytime that we have someone who's gaining weight, I refer to it more as like weight. So he's up 7 kilos, about 15 pounds, right?
Yeah.
So when we run into that scenario, I always suggest that they come into our office and that they do a body composition weigh-in, and we can start to get a feel for whether it's a lean mass gain, if it's body fat, if it's water. Our scale actually measures water. And so, and there's a water ratio as well, which is, external water versus total water. And there's like a certain, a range, which is supposed to be healthy. But so you can see what's changing relative to your, body composition. We've had many people that are very worried that they're gaining unhealthy weight and they think they're going the wrong way. And then we get them into the office and it's lean mass, and then we start asking the questions of, are you stronger at the gym? Yeah, of course they're stronger. Their workouts are good. Another thing that I would say, when people struggle with something like this or weight gain and they want to know what's going on, I also always am a big advocate of taking picture of all of the food that you eat. You will be surprised at how many times that everyone tells me that their diet is locked in, that they're eating really healthy, that their calories are in check. I've had people convince themselves that they're eating, they have been convinced they're eating 1,500 calories. I remember the one particular case, 65-year-old guy, starts at 25% body fat. He weighs about 195. And he first of all, by the way, he's sending me pictures because he has 2 homes. So he's traveling, back and forth between here. So I can't have him into the clinic. And he feels like he's getting heavier because he sends me a picture and he feels like he's seeing his love handles. Right. So I said, first of all, and he's eating 1,500 calories a day. So he felt like he was going the wrong direction. The next time he was in town, he comes into the office. He's down 4% body fat. So he's from 25 to 21%. He gained about 8 to 9 pounds of muscle while he dropped about 5 to 6 pounds of fat. And so that's why he weighed more. But one of the things that comes out of this is that I said, okay, let's be honest. You're not eating 1,500 calories a day.
Mm.
Your metabolic, your basal metabolic rate, you're burning 2,000 calories a day. You had a lot of muscle. So it's impossible. You would have lost 20 pounds in the last 3 months, right? So I try to get down to the granular level of detail of, and if you don't want to like write down or have an app to track your, to track your food, I say everyone has their phone with them. People are taking selfies all day long. If you're eating the right way, it's about 3 pictures a day.
Yeah.
Right. 3 meals a day, maybe 4 or 5 if you're having seconds, and you can learn a lot about yourself and what you're eating, and whether that might be contributing to the weight gain. Like I said, I would say you can find a scale. They're called in-body scales. There are different types of body composition scales, but Alden, wherever you're at, you may be able to see if there's a gym or a physician's office that has one of these body composition scales that you can go in more regularly and try to see exactly what weight you're gaining. Again, we've never had major bloating like that, and from just testosterone. So we don't have much experience, but we don't have, and he doesn't, I don't know what his TRT protocol is. I don't know what his levels are, so it's sort of hard to see what's out of range or what might not, where the levels are. Could they be too high? Could they be super physiologic? It's always possible.
Mm. Someone asks, should I use topical tretinoin on my cystic acne from TRT? I will answer that one, Brian. I guess topical tretinoin is not much, very efficient. Is not very efficient for a cystic acne. Really, cystic acne is closed down, and the tretinoin will not penetrate from the outside. So you really need to get on isotretinoin. That's your Accutane in United States. So.
By the way, back to Alden, I would also say the one thing that he could potentially try, maybe a different type of testosterone. He might be having some, there are different esters, there are different oil bases, different people respond to different, back to the, we had one client that had really bad acne. This is unrelated to water, right? But he had really bad back acne. It just came out of the blue. We've only had one of them. we changed the ester. And we changed the number of times that he was injecting per week, and we also changed the dose, and it cleared everything up for him. And so again, there are some things that maybe if you could work with your physician and have your physician look into of the different, if there's a different type of testosterone that, you might respond to better. That would be an option that you could take a look at. In our case, by the way, for the guy with the acne, we went to enanthate from cypionate to enanthate. It's a little bit shorter half-life. Like I said, went to 2 or 3. I think we went to 3 injections. He went to 3 injections a week. It leveled things out a little bit more. So there's some things that you can look at that, that could help.
Yeah. One last question, Brian, to end with. Can you guys comment on TRT's effect on one's basal metabolic rate?
This is one that I don't think it directly impacts your basal metabolic rate, but over time, as you get in shape. So this is one of the things that we sort of teach to all of our clients. We do a big education piece. So we spend a lot of time up front trying to explain, as we're having our consults with our clients, how to best maximize the effects of the program that they're on, right? So if you're coming to me for, people come to us for a lot of reasons, right? But in most cases, people would generally like to be in better shape. And most people would, in general, like to lose a little bit of body fat. A lot of people, by the way, come to us thinking that they want to lose weight, and they never lose any weight. But what they do is they lose a lot of body fat and they add a lot of muscle, right? So we try to get people to stop thinking about weight in general, and we start trying to get people to think about body fat percentages and getting people into the healthy range of body fat percentages, right? A lean pound of mass burns about 10 calories a day, they estimate, right? That ends up being about a pound a year of calories. So I always tell people, if you realize that as a 25-year-old, and you're in shape, and if you didn't have a 6-pack, but you were in decent shape, you probably had, 15 to 18% body fat, right? If you gain 1 to 2 pounds a year by the time you're 45, you'd be obese. You'd be in sort of the 25 to 30 to 32% range. Most people just have slight weight gains over time, and then all of a sudden they wake up and they don't realize it, but they're 25, 30 pounds overweight and they're obese. And so what we always tell them of course it's numbers and it's harder to do, but if you actually averaged 1 to 2 pounds a year more of lean mass over that 20 years, you wouldn't have gained the 20 pounds that you're in this situation, right? Yeah. And so we're big advocates of strength training. We're big advocates of more lean mass as a weight management, as a long-term weight management strategy. So we're big advocates for strength training. I'm a huge fan of cardiovascular exercise by walking. I think walking is one of the best ways to drop body fat percentage and to lose weight. People who run, if they're running or doing cardiovascular and it's too intense, obviously it can become catabolic. I think walking is effort. There are very few people who have an ailment that prevents them from walking. So, a lot of people could sort of change their health if they just stop watching a sitcom or 30 minutes of TV and listen to a podcast and went for a 30, 40-minute walk, right? So we're big. I'm a big fan. If you had 60 minutes to go into the gym, how would you break it out between strength training and cardio? I would suggest breaking it out into 60 minutes of strength training and 0 cardio, and make sure you walk a lot. That's me. And the clients that get that, the clients that get and understand that tend to do much better than the clients who don't buy into it. And it's weird because people come to us and they're searching for our advice, but they still sometimes have this wall built up because they're, they've been taught over and over, it's cardiovascular is the way to lose weight and you have to focus on your weight. And we're trying to sort of reprogram them in a certain way. Yeah. And so we're always trying to maximize lean mass. And as you add lean mass, you're obviously going to drive a metabolic rate. I have a great example. We have a great success story. Husband and wife came to us in June. end of June, and in 10 months they had both dramatically changed their life. He went from 28% body fat. He's now 9.5%. He's got an 8. I mean, it's amazing. He by the way is in a little bit better shape than me. So you know, I'm sort of happy. I'm really happy, obviously, when the clients are in great shape and better than me. But I'm sort of upset with myself when it happens. Right? It's a little bit of jealousy, but it motivates me. And she went from 16% body fat. I'm sorry, 30% body fat down to about 16%. And the way that they did it was they bought into the strength training. He has gained 26 pounds of lean mass while dropping 41 pounds of weight. So he's only lost about 15 pounds, but he looks like he's lost about 50. And she has lost 23 pounds of fat while she's gained 11 pounds of muscle. His basal metabolic rate is about 250 calories more per day, which equates to about 25 pounds a year more of calories his body is eating. So now they can, you know, cheat and they're not going to gain weight. I mean, they basically have improved the amount of food and the quality and the enjoyment of life by getting in shape, because they burn so many more calories, and she burns about 110 more. So, I think that the way that testosterone impacts your basal metabolic rate is if you utilize it for, if it was your limiting factor to gaining muscle. So I think it's Sean, right? So if testosterone was you're low, and the reason why you're not gaining muscle mass when you're going, your lean mass when you're going to the gym, and now your levels and your energy levels are up, which allows you to go to the gym and allows you to add lean mass, that is what is going to impact your metabolic basal rate. And so we're big fans of that. You know, I mean, I know that you're obviously, like me, Steven, big strength training guy. It just allows us this crazy flexibility in terms of, you know, I eat healthy for the most part, but until I start eating, you know, a pint of ice cream every day, I don't really gain much weight, give or take.
Same here.
You know, so I don't have to. I eat clean, but I don't really have to if I don't want to.
Yeah, I completely agree. Yeah. Go ahead, Brian.
I was just going to say, you know, I think that there's, you know, we talk to our clients a lot about, hey, how do you transform your life? How do you dig yourself out of this hole? And I think it's a lot of small, very small changes. When you add those small changes up, they can be incredibly impactful. You know, so if we can optimize hormone levels and improve your testosterone levels, and that gives you a little bit more energy to go to the gym, and you're able to add 10 pounds of lean muscle, and you know, maybe more, you know, you're burning 150 more calories a day. If it gives you the energy to do an additional walk, which, by the way, you know, go for a 1 to 2 mile walk a day, you know, that's if you're my size, you're burning about 200 calories a day. And then I always say, and if you eat one less piece of bread, you know, it's about 150 calories, or cut out 100 of your calories, which most people, by the way, would not miss 100 calories a day. You know, if you're eating 2,500 calories, you're not going to notice eating 2,400, you know, but it's 500 calories a day. That's a pound a week. That's how you lose your 50 pounds. That's how the guy who needs to lose 50 pounds lose the 50 pounds, you know, in a week. And hopefully if they're on a proper hormone replacement therapy program, they're adding lean mass as they go, they feel better. But it's just all of these small little tweaks that add up. And I don't think that people pay enough attention. I think that people, you know, they're not focused on their health as much as they should be. You know, eating a little bit healthier, exercising a little more. By the way, for those people who don't have experience with strength training, I think some of the best money spent could be hiring a trainer to at least initially teach you the proper techniques and the proper strength training exercises. Of course, there are a lot of great YouTube channels on this as well, but where someone can really benefit is if they work with a professional for 10 sessions, you know, and then periodically over time, make sure they have good form, make sure they're not going to injure themselves, but in a proper way to take advantage of the testosterone. You know, I think that that's incredibly beneficial. I see you've been putting out some videos on proper techniques to on the other channel to weightlift. You know, It's in,
I completely agree, Brian, because a lot of people are asking me, well, you must be doing a lot of cardio, right? Since you're keeping a lean physique, I guess 10 to 12% body fat year round. But I actually don't. I don't do any cardio. I go for long walks. I ride my bike to work once in a while. I go walking with the children, my wife. But I'm not on a treadmill or doing laps around the block or anything. It's really easy to stay lean with a flexible diet. As you said, I can eat what I want. I choose to eat healthy, but I can put in some snacks once in a while. I don't become fat, and because my metabolic rate is probably rather high since I carry a lot of muscle mass. So weight training really, yeah, it's an upward circle. You put on more muscle mass, you have a higher metabolic rate. You can eat more calories a day without getting fat. So it's it's a positive thing.
exactly. I always, by the way, recommend I have a Fitbit, a simple fitness tracker. I think people benefit. Most people probably average 5,000 to 6,000 steps a day. If they break out their phone, a lot of people, it's literally the difference of setting a goal of, let's say, 10,000 steps a day, making sure you achieve that goal, and a lot of great positive things can happen. And then you can cheat. I'm not like I don't think that people should cheat frequently on the food, but it gives you the flexibility. And so that's where people really benefit when they, the other thing, by the way, I want everyone to understand the difference of vascular exercise to weight training. I use this with all my clients. My grandfather gave me the story of give the man a fish or teach him how to fish, right? Give the man a fish and he eats for a day. Teach the man how to fish and he eats for the rest of his life. If you do cardio, it works that day. If you build lean mass, that burns additional calories every single day, even if you're not able to make it to the gym on that particular day, even if it's raining outside and you can't go for your 3-mile run. The cardio is temporary, where the lean mass is always with you.
Yeah, 100%. Okay, Brian, we have filled more than an hour here. So thank you guys in the chat box for all your questions. We couldn't cover everything, but I already said it was the last one, and new viewers are adding up new questions, but we'll take those another time. You can leave those in the comments of this video and in our Facebook group, TRT and Hormone Optimization. So I've seen that some patients are asking about your clinic, Brian. How can they come in contact with you? How can they work with you?
You can Google, Google Rewind Miami. The clinic's name is, our website is actually rewindantiagingmiami.com. Our phone number is 305-922-9622. So you can give us a call. We have we put a lot of good information out on our website, so it can answer a lot of questions. If you email us, we have an introductory email it's actually really long. It's pretty in depth, but it's got a lot of good information in terms of what our first consultation involves. And obviously, if you're in South Florida, come into the office and meet us in person. And I'm always happy to spend time. I'm very passionate about it. Having been out of shape and low energy, I take each sort of client as a personal project. We always want to have everyone have amazing results. And so I'm always happy to meet with people and talk to them about health. So yes, you can follow us also on Facebook. We have a Facebook page, Instagram. It's always under Rewind Miami, Rewind Anti-Aging Miami. And we'd be happy to help anyone who needs help.
Okay, thank you so much, Brian.
Listen,
okay,
thanks for having me.